and Hope Christian High School schoolmates. I think most of us are from Hope Christian. Welcome to the Silverian's 72 chat group. Next year, it will be we will be celebrating our 50th anniversary and our golden year to give thanks to God and to our alma mater. Our batchmate has started a monthly chat group meeting to stay connected. Tonight is one of the many programs we hope to connect with each other. We hope you can enjoy and learn from tonight's program to be shared by our schoolmate in a timely manner. To start the program, let's begin with a word of prayer by Pastor Rosa Ching Xiao.
Unmute, we cannot hear you, we cannot hear you.
Okay. Dear Lord Jesus, the COVID-19 has affected the life and health of more than 1 million people across the world. And it has also affected many healthcare frontliners who have been struggling to safeguard the health of those who are affected. And then we're truly grateful that tonight we can really hear from the very frontliner, Dr. Daniel Tan, who himself has come so close to death with COVID, but has survived. And we know that in your word, you said, Lord, that the whole creation has been groaning until now, as in the pain of childbirth. And not only the creation, but we also ourselves, who are the first fruits of the Spirit, we also groan inward, awaiting eagerly the adoptions of Son and the redemptions of our body. For in this hope that we are saved. We also remember your word says, in this world we have tribulation, but in you we have peace. And you have told us this thing so that we can have peace in you. We commit tonight's meeting into your hand. May you guide Dr. Daniel Tan as he shares from his very own experience how he has overcome and what we need to know and learn from this. We commit the whole session into your hand. In Jesus' name we pray. Amen.
Thank you, Sister Rosa. As you know, we are trying to reminisce our days at Hope. And to do that, I have arranged for one song to be sang that we can reminisce about our school. Let's all sing together with the choir. Trust and obey. All right.
When we walk with the Lord in the light of His word, what a glory He sheds on our way. While we do His good will, He abides with us still, and with all who will trust and obey. Trust and obey, for there's no other way to be happy in Jesus but to trust and obey. Not a burden we bear, not a sorrow we share, but our toil He does richly repay. Not a grief or a loss, not a frown or a cross, but His blessed if we trust and obey. Trust and obey, for there's no other way to be happy in Jesus but to trust and obey. But we never can prove the delights of His love until all on the altar we lay. For the favor He shows trust and obey.
I think it reminds us of our chapel time, didn't it? So as we move on with our program, I'd like to ask our Alumni Association President to start with a word of greetings. Alumni President Deacon Oliver Wee.
Ai kay ho ami o mi akyo Oliver. Go ai ti sia tai piao dan kalam how you chong hoi like tagelang kong kyong hio, especially the Silverian 71. Ni tayo kini atiet peto, you have two precious metals associated to you, no? You are celebrating both your golden jubilee. At the same time, you are the Silverians. No? So congratulations, no? Too bad dan kini sige yak chiang go na buhat nang to kiang chok go ng bang eni go ai yao chia tage go. I would like to invite everyone to have a grand celebration, no? Dan sai yong elo, we have already 3 batches, no? Sai golden jubilarian ko sai silver jubilarian that will be celebrating together. Let's hope and pray that everybody, no, that I would like to ask everyone to pray that next year indeed we can celebrate this special occasion. And also kinio si dan oteng chitsap go chuni go dan chitsap go chuni dan si eni go ang bang eni chapit ge si watang tuidan twa yung alumni grand homecoming, no? Dano what lang undi Kiang Chok, no? You know, Silverians is 71. You're very special actually to me because you know the year you graduated was actually the year I was born, no? So you guys are celebrating your 50th anniversary and I'm also a golden boy this year, no? So once again to all the Silverians, congratulations, keep up the good work. And thank you for your support for our 75th anniversary project, no? Din sa iya na baka sa iya pa your batch din pa, no? 71 Silverians is very actively supporting the renovation of our theater hall. Dan chapel go dan theater hall. And I think dan biang DCT Alejandro ko and Sami here would know more details about this, no? About dan sige how your batch is helping the alumni association and the school renovate our chapel. Once again, thank you and congratulations.
Thank you very much, Deacon Oliver Wee. Now, we're going to the main part of our program tonight. And to introduce our guest speaker, we have Silverian Ramona Pedro Leon to introduce our speaker.
Good evening, everyone. We are privileged to invite Dr. Daniel Tan, a fellow Hopian and a sought-after speaker locally and internationally. He will take us on a personal tour on how a frontliner spent his days during this pandemic. Dr. Tan is an alumnus of Hope, graduated from Hope Christian High School in 1969. He pursued his degree in internal medicine, specializing in pulmonary at the Medical College in University of the East, Ramon Magsaysay Memorial Medical Center. Before he retired 3 years ago, his very successful practice was at Lourdes Hospital, UERM, MMC, and Metro Hospital. He received many awards for his contribution to the medical field, including one as Hope Distinguished Alumni. He was instrumental in abolishing public smoking in the Philippines, banishing smoking in public way before it was presented globally. He is also a coveted international speaker on lung diseases and treatments. Finally, his most valuable and precious award for life is his soulmate, Loretta, a fellow Silverian. Let's welcome Dr. Daniel Tan.
Okay, good evening. Good evening, everyone. We also have some listeners who may not be able to appreciate emang way, lanang way. So I'll use Taglish na lang. Is that okay, right? Okay ba yun, Sam?
Yes.
Yes, of course. Yes.
Yeah, okay. So this is more of a conversational, a kind of a storytelling. Tama naman yung plano natin is like to say thank you to Sam for this invitation. But of course, initially I also have some reluctance. Kasi there will be different expectations. The bigger the audience, kanya-kanyang expectations of what to expect from this presentation. Number two is, of course, this is on the basis of your personal experiences, what you have read, and what you have discussed or heard from friends, reliable experts, as a basis for your understanding of what's going on nowadays in the country and in the community we live in. So I was struck by two words from Judy, why kapatid, who is also in the audience. Sabi, ano bang goals mo? Ano bang objective mo naman? Kung iba-ibang ang expectation nila, ano bang objectives nila? So when Sammy called me a few days ago, and I was already preparing, I realized it should not be a lecture about diseases. It may sound sometimes not easy to understand even myself, because please understand that what you may be expecting me to talk about is an evolving science. And nowadays, because overwhelming interest and about COVID pneumonia, because it's always a pneumonia, ang laki-laki ng sacrifice ng mga non-COVID diseases. Many patients with heart disease, diabetes, cancer, all kinds of illnesses outside COVID have been neglected because kayo rin di ba? You are afraid to go to the clinic, you're afraid to go to the hospital. So many of these very, very important illnesses have been left behind. Ang fino-focus lang parating COVID. So by the time we see many of these patients nowadays, they're in bad shape because of fear. Fear to go to see their doctors. Number two is, yung uso ng telemedicine this is very personal. It seems to be the answer for the time. It's the best we can offer. But look, if you don't interview patient face-to-face, ang lalaki mga compromises. Because we cannot see really clearly we cannot smell the patient. We smell the disease sometimes. We cannot see how they express their illness well, except through the screen. And we cannot do a good physical examination. So more often than not, yung mga nakarating sa kliniko, when by the time I get to see them, off the record, I would have disagreed with most of the prescriptions. It's like a shotgun treatment more often than not, because you can't focus on the specific problem and dwell in it, because it's always through the screen. So it may be convenient, it may be just the best we can, but kawawa kayo. So that's my personal view, okay? All right, and so my goals, ang habang list ko eh. But to begin with, my goal will have to be from a perspective that I'm an internist. And I just happen to be a lung doctor. In a way, good and bad kasi ang COVID is almost always the lung, di ba? Kawawa naman yung mga hindi lang. Ang kawawang practice nila, practically no patient sa ibang specialty. So even doctors now realize many are struggling also. Okay, that's another comment na yun. So I want to share with you the discipline of the life of a doctor. Yun. And then in the process of a day in the life of a doctor, a practitioner, maybe you can appreciate how we think, how we make decisions for you if you happen to be the patient. And then at the same time, you will be able to appreciate the healthcare system that we have in the country, or uniquely in a particular hospital. And think how we use the available resources, or how we go around when some of the essential tools are not available. Then understand how we can win despite certain limitations. So I'm going to bring you on a journey. Yun na lang goal. So at least alam na ni Judy. That's my goal, to bring you. And along the way, I would like you to also reflect. If the next patient will be you or your loved ones, how can you now be better prepared as I share with you this journey? Only a one-day journey. And think about how you can optimize the situation if you were there. Even with the limited knowledge and experience about a specific complaint or list of complaints. And then look into the role of family members to make it a higher chance of a win-win situation. And maybe along the way you will understand. Okay, so let me now go into the slides by removing myself. Okay, so sandali ho. So that's the title that Sam and I agreed on, and hopefully it will be something that will be helpful to you. So this will be what I may be or may not be discussing. First, I will share with you that I am not the real frontliner. Then I will avoid giving a lecture because I love to give a lecture, because when I start, I will end in 3 hours, and you don't want that. Then this will not be a discussion on the public policy of how to contain COVID. But I will share with you, as you say, how do we begin? Sa totoo lang, I begin my day when I go to sleep, because the phone can ring. And I'm very fortunate that when I sleep, I don't hear the phone ringing. So you'll always realize that when the phone rings, two people will be awake. It's my wife who will wake me up to listen to the phone. Okay, so I thank my wife for it. Kawawa din siya. So how do we begin the day? When I get into the phone, somebody will already call me. It's not an office hour. It's already a call because some patients are in the emergency room, diba? And people stay awake in the emergency room, waiting for patients, attend to patients. Some are really urgent. Some are there for the convenience, because hindi na kailangang pumila sa clinic, because you get immediate attention. But more often than not, they are not really urgent. It's more for convenience. So you get the call and you get all this, but along the way, you give advices to your frontliners sa emergency room. And I like you to know, 24/7, as early as 3 or 4 a.m., this gentleman would have been there. He is a real frontliner. He makes sure that when he cleans the floor and the wall, literally wiping the wall, protecting us from infection. In the laboratory, they don't sleep. Because the emergency room, when orders are made, they're there. Non-stop. And the machines are on 24/7 because many of them have to function well only in a very cool environment. And then by 4 or 5 a.m., there are already some consultants avoiding the traffic. Nandun na rin eh. They're already reading the film that were done a few hours earlier. Because by the time I am going to visit them, they would not say, let me look at it. Actually, they read most of them already. And they start typing the unofficial until they have a discussion with their consultants. And then in the other room, in order to avoid the traffic, the ultrasound has already been cleaned, and you see this reflection. This is a plastic partition where the patient is on the other side. Only the hands is extended to the other side. It's a new norm in the practice. Actually, I don't even know how these people look like. Everybody's wearing masks. There is this detachment. I couldn't even see their name because they have to wear this special gown. And once they're in and out, they have to change a new gown. So this is all new since last year. And then when you step out, when you're about to enter the hospital, you already see people wearing that. You know they are not patients. They are hospital staff waiting for the ambulance to arrive. And inside, everybody's prepared. It's a war zone. Yun. During the surge, of course. Pero now medyo na-relax na, right? And when the call is in and out the emergency room, our assistant frontliner, the frontliner are the younger people, younger doctors who will report to us. Siyempre, ang consciousness is anything, can it be COVID or not? And we use some of this basic screen, checklist. Yeah. And then when they start going close to the patient, talagang shielded na, right? And when the examination is done, at the back of our mind, nandyan na yung orientation namin eh. Kinakategorize na namin kung mild, moderate, severe. That is aside from the non-COVID. We're just saying kung COVID yan. So we know already whether mild is only because of symptoms. But the moment somebody is moderate, we're talking about medyo nahirapan na siyang huminga. The oxygenation may still be well, pero napapansin namin na medyo hirap na siyang huminga. Pero pwede pa sa bahay yun siguro. And then when they're severe, it's always about using the oximeter here, because the moment we see the oxygen is low, you can't go home because you don't have oxygen at home. So yung orientation namin familiar na yun eh. Every day yan. But you know, it's not just like that eh. We become even more conscious eh. We always ask for what's day one of your symptom, because day one of your symptom, which is 0 here, the few days before that, you were already very contagious eh. Ang concern na namin, hindi ikaw lang eh. Tapos na yung kalat eh. Eh kung kasama mang matatanda, sorry. Sila ang mas worried kami, kahit na you tell me you're only in your middle age. We're worried about the senior. Because they were already exposed by you. But you're only a suspect. But look at this curve. The curve goes up. The curves go... Sandali lang. Ano? And the curve goes up, meaning to say the viral load would have been so high, the most contagious would have been within the first 3 to 5 days. Can you see that curve? Grabe. By just talking, by just a little cough, grabe ang contagiousness. So you can have all the viral-like symptoms, di ba? So conscious kami sa complaint, but it's not the complaint. It's always about day what? Day 1 or 2 or 3. We're looking at you as how contagious you can be. But yet we have to do the swab. We're not even sure kung contagious ka as of what day. But look at the viral load. By the time you go into the 2nd week, this is the truth. Even when the viral load goes down, if you're going to become serious, eventually die of it, it's not because the virus is still there. It's because your body overreacted to the virus. Maybe I can explain that later, but that's the way we see. Either you get well, majority 90%, or you have to stay. And when you stay, that means you have 2 trajectories then. You stay for observation, going to be home in 1 or 2 weeks, or you stay, you continuously get worse, and we know ahead of time, based on certain parameters, you're not going to make it. But every day we're going to watch you, we're going to visit you, pero alam na namin who will survive, who will not. So we look at this day 7. Majority would have been better if you belong to the mild to moderate. But the ones sick enough, the key will be on the basis of 1, the history of exposure. Yun ang tatanungin namin sa inyo eh. Hindi lang yung kay pang ilang araw eh. Then we ask for the symptoms. Because when you do not have symptoms, kahit na may exposure ka, very easy, stay home, right? Tell the barangay, locked in. Gagaling ka eh. Yun. Ang problem is kung nandiyan ka na, within a few hours we get the swab results and you're positive, we have to decide for you. For us, it's not difficult. Short of breath ka ba? Anong level ng oxygen? See? Because if you have all the symptoms of viral infection, you can still stay home. The key is not about the viral symptom. It's about yung level ng oxygen. It's about how fast you breathe. Because COVID is always COVID pneumonia. So we'll ask again, do you have this? Ano ba yon? Symptoms ng virus? Anong level ng oxygen? Hirap ka bang huminga? But you know, we are particularly sensitive. Itong kaharap namin, naka-PPE kami. Naka-PPE ng mga assistant namin, yung mga tunay na frontliner, they just report to us. We guide them in the decision making. Look at this. Are you at risk? Not just being confined or at risk of dying, if ever. You don't see this among teenagers eh. Because teenagers don't have a risk of AIDS, cancer, chronic kidney disease, diabetes, heavy smoker, heart disease, overweight, HIV, pregnancy, or heavy smoking. Sila ang high risk of getting worse and not able to overcome or cope with the massive inflammation ng baga, practically na hindi makahinga. So, you know, there's another aspect of suffering. We don't just talk about it. Kaliwat kanan, tinuturo ka ng karayom. Blood extraction. You think that's fun? When we get arterial blood gases, it's painful on the arteries. And when we do that, actually, alam na namin who among the patients are in really bad shape. Alam namin, we just don't express it in our face. You see us very calm, but we can predict who's not going to be in a good shape in a couple of hours or couple of days. Nasa blood gas, and that's a painful blood extraction. Very painful because the nerves are wrapped around the arteries. And then experience din kami by looking at the X-ray and the CT scan. May idea na rin kami yung rapidity ng progression. Alam namin yon. They sent to us by Viber. We may not be there. You call us with all these awards as frontliner. Ang mga babatang doktor na sa frontline. Yun. And when you show us the X-ray, alam namin ng typical ng COVID, yung itsura. Ito, 80 years old eh. Lagnat-lagnat lang. Ayaw pang magpa-admit. O sige, umuwi ka. Okay pa naman ang oxygen. Balik ng balik. By the time the patient came back, mababa ng oxygen level niya. And just to show you how it looks, kung itong X-ray, how does it look when somebody says, Doc, hirap na talaga ako. And then the frontliner will do the CT scan and say, normal should be colored black. Normal. Look at all this white. Parang alambre. Hindi makaka-penetrate ang oxygen eh. That's how they die. They die because they're gasping for air. Even if we're giving oxygen, hindi makaka-penetrate. Look at that. Look at that. It's like how I wish I can just change your lung with a new one. Transplant a new one. They're gasping and they can't breathe kahit na high concentration oxygen. And look at it from another angle. Kung nakatayo siya. This is from the front of the chest going all the way to the back. So when they tell me, oh, Doc, I said, I'm on my way. I'm on my way. I'll rush to the emergency room, Tapos yung CT scan, they'll show me this image. Look at all this. Look at this, all this white. This can be seen in less than 7 days in some patient, but majority on the second week. Kaya mahalaga yung timing eh. Kailan nag-umpisa ng sakit? And then they start turning blue despite the oxygen. So we call that code blue. Right there sa emergency room, by the time I arrived, nakatubo na siya eh. Sabi ko, oh nga, I agree. Sometimes we have to do audit eh. Did you do it at the right time or did you do it too late where there's brain damage already? Oh no, doc. When we came dead on arrival, in fact, we tried to resuscitate. Okay, we resuscitate. They did their best. Everybody in PPE. And then they put them back, the patient back on the nakatihaya, right? Nakatihaya. Let's say the patient is start to be wakeful, and then we shoved in, stick in a suction catheter. Maybe there's plema. You think that's painless? That's painful. That's painful. And then we have to decide, okay, where do we put? Wala pang result ng COVID eh. So let's put it in the probable COVID ward versus confirmed COVID. Is it on the critical care? And every floor, you can see all this partition and you can see video watching and all the monitors on all the sounds, all the alarms. We can hear it at station even before we enter. And for the most critically ill, they will have their isolation room. You know what's the sadness about this situation? Even if the patient were awake, they cannot talk. Nakatubo eh. Kung makating likod mo, nobody knows na kailangan ikakamot namin sana. Right? Kung masakit ang likod, masakit ang liig dahil mali ang posisyon, mainit, o umihi na sa lampin, minsan na-overlook namin, kalat ang dumi because we're busy and the patient is left alone. Maybe the patient is now awake and he wanted to talk to the wife, to his wife. We don't know that, right? Or maybe she wanted to talk to her husband. We don't know that. All we hear are the alarms. Because the alarms are supposed to ring louder that something is wrong with the machine or something is wrong with the patient. And of course, those who can afford it, they will have their personal room, special nurse, everybody on PPE, and we will monitor them even with their personal monitor on top of the monitors on nurse station. And we will be given calls. So while we're making rounds on the other floors, then we will be getting calls in our cell phone. Oh, this is now the patient, yung kanina, yung katutubo lang, di ba? Nasa room na, nakahiga na, here are the vital signs, yun. And then, doc, we have a problem. The oxygen is not going up despite giving pure oxygen. Okay, there's a way, you call that prone position, right? So they'll put prone position and then hoping that the oxygen, and many times, look at that, wait, tumaas ng oxygen, 100 na. We're happy, but the lungs are just as bad. And then try to imagine while you're prone, isa suction namin kayo. Okay, any plema? Okay, send more specimen. You didn't do that, get me more specimen. They'll put in the suction catheter. You think that's painless? Doc, the patient is agitated. Sedate the patient. You know why the patient is agitated? It's pain from the viral infection. It's pain from the tube. It's pain from the line. The patient has not been prepared in the right position. Nangangawit ng likod niya, nangangawit ang liig. We don't even know that. And the patient is just agitated. Sedate the patient so that he can breathe synchronously with the machine. Ay, buti naman nag-improve, but we're not even sure just because the oxygen is improved, the patient is. Let's start medication. We start medication with steroid to make the patient breathe better. We give this and this medication, hoping that the intense inflammation will not progress. Because when the lung turns all white, it's like there's no way oxygen can enter. And every time I have to visit one room, I have to change. Enter another ward, I have to change. We never stop changing. One use, throw away. That's why we can get infected, right? Because all we need is that little space to allow the floating aerosolized virus particles to be inhaled through the side of the mask. So now you understand why visitors are not allowed. Baka mahawak kayo kahit na nandyan ang loved ones ninyo. Then before niya, Doc, hindi na umiihi yung pasyente. But teka, I have a clinic. Patients are waiting eh. Doc, okay, can you just give us the go signal? Okay, do this, we do that. You know why? Because even the viruses can go everywhere. We call that systemic spread. After all, why do you feel muscle pain? Nandun din ang virus eh, di ba? Why do you have diarrhea in COVID patient? Kasi nandun ang virus sa intestine. So when it spread, of course, you will see all this cling, cling, cling. We'll be monitoring them, and then we have to dialyze this patient, hoping that the kidney will open up, diba? And then when we do that, we are still looking at the vital sign, because many of them, by the time the kidney fails, the blood pressure is also falling. And of course, not everybody makes it. And when the patient dies, I wasn't there. Nasa clinic na ako. So I have to quickly rush down because the husband was waiting for me. So I wear my PPE, going to go at least to visit somebody where my frontline assistant took care, following my instruction. The most I can do is to comfort somebody without telling him. 2 days ago, alam ko na she won't make it. You see, the family doesn't understand. Not just the COVID, the pain and suffering the patient has to go through, the inability to communicate. Ang sakit din sa amin eh, because how can I explain to Lolo the process of how COVID slowly killed yung asawa niya? So you'll ask, Doc, can you just tell us honestly, how do patients die? Well, this is from Lancet Journal, and we've seen this. We were writing the death certificate attributed only to COVID-19 pneumonia, and from a person who was previously healthy. Oh no, the patient died of COVID, pero it's due to the old age kasi may advanced disease na, meron ding cancer. Or another one, it's kasi 97 years old. 2 days ago, 97 eh. It was easy for the family to decide, Doc, would you kindly please not overdo it? Lolo is too old. We can also put in a death certificate organ failure, septic shock. That means kalatang infection ng virus this time, not bacteria, multi-organ failure. And why did the patient die? We couldn't write in a death certificate. No, because we withhold life support. Ayaw ng pamilya. They told us not to give medication to sustain the blood pressure. So I had to rush back to the clinic. Remember, this is just 1 day in the time. Just when I arrived, the phone would ring. It's another patient naman in the ward, in the floor. So I have to tell the patient, sandali lang ho ha, sandali. You know, yung isang interview ng isang pasyente, minsan di matatapos-tapos eh, kasi walang tigil din ng call eh. It's multitasking. So how does this lady in Redwood feel? I couldn't give her the full attention. Tama? Hindi pa tapos ang interview, the phone will ring. And I have to say, pasyensya lang. And then behind me, the laptop is there because there will be some messages, email to say, please answer this, we need this for this and that. And then of course, they're occasionally happy. You know, the patient next in line is the one who came in and say, Doc, you remember me? Hindi ko na siya matandaan eh. Ito pala yung pasyente na who survived after 1.5 months, 85 years old. And I always reminded him he got well not because of us. For somebody, they'll say it's not your time. But we always remind, who made you well? Kaninong tinuturo niya? Panginoon Diyos. So we always want this to be remembered. So we have a picture taking. Once in a while, when I do that, ang daming mga chismoso sa labas, Doc, what are you doing inside? Pwedeng kami na rin. Siyempre, when the next patient came in, they always want to have a picture taking when it is about good outcome. So I had a chance also. He's a very special patient, and we had fun. So you can see within a couple of hours, you have to deal with serious, you have to wrap around a a sorrowful parents, di ba? So, it's all about cell phone, right? Let me share with you, in a day's time, I would receive tens and tens of cell phone. What's the most common text messages sa tingin mo? Try to imagine. It's always from our residents, our frontliner, reporting about this patient, that patient. And it's not just once a day in one particular patient, several times a day of one particular patient. So what if you have 10 patients? Yun, puno, puno. That's just reporting about patients. And then we have text query from patients, di ba? Doc, can I have vaccine? Siyempre, Doc, I'm afraid about getting the vaccine. We have to answer back kasi kilala ko yung mga pasyente. Doc, can I give it to my grandmother? Doc, I have asthma. Will I have allergy? Kasi allergic din ako, baka ma-allergic. Yung lahat ng question na yan, we have to answer. By the time I see them, they've been there for 4 hours. And that's only in the middle of the day because they've started texting at 6 a.m. asking for go signal or give them the assurance. Doc, can we have a certificate? Yun ang common queries. What are the most stressful call? When the question begins with the why. Doc, why is my mother getting worse? Oh my God, how can I tell them that everybody's supposed to get well? When every question begins with a why, it's like I don't think I'm communicating well. Or I think the patient's family is not understanding the gravity of the situation. What about the most inspiring? Doc, happy birthday, ha? You're one of the most, we are blessed because of yung mga ganyan ba? Wow! Suddenly, may mga magaganda nga. God bless you, Doc. Sana you survive longer than my father who died under your care. What? Yung mga ganyan ba? Most embarrassing. Okay, maybe I should not share about most embarrassing. Well, there are things I don't want to share. Baka makita ni Mrs. eh. Yung mga pasyente, yung mga old patients, of course. Doc, have you eaten already? Don't forget to eat, ha? After another hour, Doc, have you eaten already? Baka ma-misunderstood, dalaga ito. Hindi, yung mga matatanda. Many of them care. And then, of course, yung most guilty feeling, kanina pala tumawag si Mrs., I haven't answered her call. Yung mga ganyan ba? Or somebody who needed me within my family, having fever, having this and that, and I couldn't even answer it because I overlooked it. So these are the things. And this goes on the whole day. So in between all these works and call, you have this cell phone and text message. I thought they're supposed to be the most convenient. Yes, convenient for everyone. And I have to remind myself, that's why we are in this profession. Because every call, every text, they expect a very sincere, ample response. But I couldn't do it right away, right? And then if ever the patient goes home, don't forget there's now a beginning question mark on the science of long COVID. Discharged now, but they haven't recovered. Their quality of life continued to drop. We call this the long COVID. Persistence of fatigue, kaya hindi sila makaka-recover over time. And the older you are, the worse and slower ang recovery. And then some of them, yung complications that we supposed to see them during confinement, when they get home, we want to send them home when they can breathe better and recover at home. But remember, usually kasama sa COVID pneumonia, other than the pneumonia, malapot ang dugo. So let me share with you how they suffer. Some of them go home with scarred lung. How can I explain to them kapag nandyan ang peklat, ang hingal nila permanente? That they will need oxygen indefinitely. You heard once in a while they need lung transplant. We don't do it here. O tiisin mo na lang. How can we say that to patients? And then just when I was trying to think about how to explain to one patient, I got another call. Doc, you have an emergency call. It's a patient of yours who was discharged 2 weeks ago. But in fact, he was saying that after, on the day of discharge, nagumpisa na sumasakit ang paa. I received the same text message from this family. Oh yeah, I remember. Nakalusot siya. And then the frontline young doctor sent me the picture. What's the difference between the right foot and the left foot? Yung kulay. You know the problem? Baradong ugat. Emergency CT scan. We call that CT angio. What do we see? Take a look. You will see the dye flowing. This is the left leg and the right leg going down. I have to go up and say, I have to find the reason. It's going down. It's going down. Look, it's going down. You can see blood going down, but you don't see the white dye going down here. That's the bone. No. That means ang barado ay nandito. Can you see this? Can you see that? You can see this one is the equivalent of the cross-section of the ugat. The blood was flowing through on the left leg, but you can hardly see the white dye passing through, and there was hardly any blood going to the lower part. No wonder. Parang yung 10 to 20 times yung sakit ng pulikat. Then I have to rush down to say, because the text of the daughter was say, Doc, why is the pain not going away? Yun na naman ang most stressful. And what can we explain? Baradong ugat eh. So I have to refer this patient to a vascular physician to give a blood thinning agent. So after treatment, umuwi ng pasyente still in pain. And the only thing we hope is hindi mangingitim to leading to amputation. And then I got the call. I said, now I can go back to the clinic. And then another call. Hindi naman COVID, breast cancer stage 4. And it was a special request, Doc, my wife is not going to make it. Can you just pass by the room? But I got patients waiting. Kanina pa. Okay, I'm coming. So the moment I entered the room, this was the exena I saw. She was short of breath. No amount of oxygen can build it up. And that was already 1 p.m. Remember, we started the day 1 p.m. When I entered the room, I saw them. The husband, ang tawag ko sa kanya, boy, he couldn't say anything. He just kept quiet. He understood the situation. But when I saw that, what else can I offer? So lumapit ako. And that's all I can do. And I told the husband that we'll pray for her, we'll pray together. And that's the comfort I can give. So she passed on already. Maybe that, maybe the true deliverance from physical suffering on this earth. So we understand that when the virus enters, how in the world did it enter? Kasi, kung sana itong surge would not have happened if everybody was given the vaccine by December. But we're a poor country, di ba? We don't have the chance to fly out to another country to get the shot and fly back, just like in the Middle East. You know, European will fly to the Middle East to get the shot because they can afford it. They can fly with their private plane. So if there's a chance, we don't do autopsy on them, but we're beginning to understand how deadly the virus is. Listen, autopsy na ito eh. Itong airway with this hair cells along the airway. Can you see the arrow there? Those are the viruses under electron microscopy. Patay ng pasyente, nandiyan pa yung virus. Kaya nga, look at the tragedy. Hindi na pwedeng bisita ng pasyente sa CCU. Kasi nakakahawa eh, di ba? And when the patient dies, no last word or statement. And when the patient died, there's no last communication from the family to the patient. And when the patient dies, you cannot even go to the bedside. They will wrap up the patient. They do an autopsy because nandun pa yung virus. And within 24 hours is possible cremation. So you bring home that little bottle. You can see all of this. These are viruses. That's how the virus looks like electron. And it's spilling into the airway. This is the airway. So yung mga buhay na pasyente, yung Kalat na yan. So it is that contagious. Of course, some of them suddenly die, and now we understand through the science, it's an evolving one. Yung biglang nag-block ang airway, and then bagsak ang blood pressure, they're dead within a few minutes. Blood clots blocking the airway, no blood flow. They're dead within a few minutes. To me, that's merciful eh. And you say, kalat nga eh, nasa kidney. Oh, this is a virus in the kidney tissue. Despite the dialysis, the kidney fails. This is Mr. Che. I asked permission, di ba? May privacy law. On the day of admission, ginaganyan pa ako, okay siya. And he got worse to the point the lung leaked air. We had to put in the chest tube, stayed in the hospital more than 2 months. Even hirap na hirap, this is high flow oxygen, high concentration, just to build up his spirit to say, kaya mo, take a picture, let's show it to your wife, because the wife cannot visit him. Yun. And he survived. But he's home now on the 4th month, still short of breath. Hinang-hina pa, long COVID. What can we do? Text na lang. Doc, how come the recovery is slow? Sorry ho, it's called long COVID. It's going to take long, but be patient. Be patient. And of course, I can share with you, not everybody dies. What is this guy doing from the day he was short of breath? He was about to go home. Ang ginagawa niya, tignan mo yung posing niya. Tignan mo. Right? So there are nice stories to tell. People who survive. But are they the elderly? No. They're the stronger ones. They're the stronger ones. So, now I'm going home. When I go home, I'm tired. Sabi ni Lori eh, how come you speak so much sa hospital? You give lectures left and right. When you come home, you're too quiet. Because at home, I have time to reflect. I think about what happened during the day. When I drive home, I'm thinking about them. At the same time, receiving calls along the way. Then here is what I can share with you. The realities about the virus. It's going to be like influenza. I'm almost sure. There will be more vaccinations for the new strains in the years to come. It's all about vaccine. That's it. Nobody can be spared. Nung na-confine ako ng April, nakalusot ako. But we all know in our family, it was the same April, 2 uncles and 1 aunt passed away in our family. In May, when I lost my voice, but I started to return to practice, to my clinic, I was using the whiteboard to communicate with my patients because they like to see me face to face, but they didn't know I lost my voice. In the month of May, in the hospital where I work, we have subspecialty. I'm in the specialty of pulmonary. 2 senior cardiologists, older than I am, died of COVID. Miyembro ng department namin. So, hindi namimili ang tao eh. Number 2, consistent. The high-risk vulnerable group. You know already. Obesity. Chronic emphysema, COPD. Heart disease patient. Diabetes. Silang hirap na hirap to overcome the virus. Next. Oh, we will just hire special nurse. We will buy oxygen sa bahay na. We can afford it. No. There's the right time to be in the hospital. The right time to give the antiviral. I-delay mo, peklat na. I-delay mo, hindi na namin ma-reverse. You're dead. Yung iba naman eh, mild lang eh. Takot na takot, nagpapa-admit na. Madaling mahawa naman ng ibang infeksyon. During the surge, that was not easy. Unless you're the former president of the country or whatever, right? I mean, this thing do work, yung connection. We cannot, that's reality. But the timing of the arrival for care, the right medication, the intervention, the right team, may chance. Kung delay, kahit na maraming doktor with the best hospital, no guarantee. Medications, you can use it now, you can use it later. Science evolved. Those we thought last year they would work, they are all thrown to the side. They were useless pala. Yung mga ngayon, mga drugs na doesn't yet to be proven to work, some people insist to use them. What can we do, right? Desperate treatment during desperate times. And there's something that really hurts. What is lost may never be recovered for the next few months. Yung human touch, yung relationship between doctors and patients, the face-to-face, the tone of the voice, the communication, the sincerity that can be seen in body's language. Next, how can we empower patients when we don't have face-to-face? How can we share information so they will understand that even the family and the doctor can be a team? Because we need decisions from the patients. We need decisions from their families, di ba? To do this and do that. So there are many values that are so important in relationship, in communications. They were lost for almost 2 years. Some of them were regained, yes. Some need to be reinforced. Some becomes the perfect excuse. They don't visit. I'm spared from spending time to explain to the family. Mali yun. We know that. And then the challenge of limited resources. And it also gives me the understanding. You can have everything. The best hospital in Makati, in this here, in Quezon City, here and there. Kung mamatay ka, mamatay ka. Because of all the other factors involved. It's not just the hospital. It's not just the best doctor. No. It's about all of the above. So, when you think back, this is also the reflection. How in the world did they get an infection? Hindi lang pala isang nakasakit. Almost always ang story, the whole family is positive, di ba? Akong nagdala ng infection sa pamilya ko eh. Nag-positive silang lahat eh. It's about wearing mask eh. Mali eh. So the same question, di ba? How can we prevent the lung from becoming white? To begin with, don't get infected. Yung wear the mask right. Know what to touch and what not to touch. Yun. And get vaccinated now. Wala na yung kailangan pa ba? Pwedeng tsaka na. Pwedeng yung brand ko. Excuse me, ang daming namamatay na sa South. Baka maubusan pa tayo dito. Baka ma-prioritize pa sa South. But then that's part of what we call public education. Yun. Yung mga ganyan ba? Is alcohol better than soap or soap is better than alcohol? Sagot. Soap. Alcohol may special requirement, at least 60%. Di pwedeng i-dilute. And it's all about yun. The 20 seconds. 20 seconds. Yung mga steps, don't take it for granted. Diba? 20 seconds. Rinse, dry off, 20 seconds. And when somebody sneezes, run away. Off the record. Everywhere you go, puro plastic. Papasok ka sa loob. Biglang nakatching. And nandyan ang plastic. Where will it escape? Everybody's sealing their space. Where would the virus go? Para uso-uso eh. Window should be open pero mainit eh. So air conditioning, wala namang exhaust. Wala namang specific high-grade exhaust system. Now, unidirectional. And then how do they try? Doc, si Lolo-Lola nakakulong naman sa room eh. Paano nakuha ng infection? O, eto ng explanation. Nag-sneeze into the doorknob. Somebody touched the doorknob. Then somebody touched it with the hand and then rubbed the eyes. Yun na yun. And then somebody was kind enough, Haching! Pero itong gift pinapadala sa inyo, this is the food. These are the places we call that fomites, where the viruses can stay long enough to be picked up by the hand and you put it in your eyes. How can you escape? Kaya itong rule, no, dapat. But when was the last time we saw that this is now a new movement? Kumusta ka? Kumusta? Everything is about that. About face shield. Yeah. It's about the mask. Yes. Hand sanitizer. Okay, let's just keep this. And then, you know, we avoid, run away. And then don't use yet medication that is not yet proven. Maybe later, but not yet proven. As of now, there's a newer publication, June, hindi pa proven. Pero Doc, I took it, it didn't get well. I can tell you also my patient taking this medication, na COVID. But how can I use only one? So we should trust the expert, not me, the expert, the researchers. You cannot use only one study that is subjected to a lot of scrutinies na may problema sa study per se. And out of desperation, you and I were going to use it. You say it's harmless? Yeah, because the dosage is useless. Because to make it effective, it is toxic dose to the nerves. That's why everybody seems to be all right. Kasi hindi pa nahahawa. Number two, kasi nagpabakuna rin. So when you have all this different intervention, how can we claim that this thing works? You understand what I'm saying? How can a drug prevent when majority can get sick and be asymptomatic and claim that it works when not knowing positive ka pala, only you are asymptomatic? You understand what I'm saying? Maybe it will work, but we need more proof. Can it prevent patients from getting worse with this kind of drugs? How can we say this is a drug that works when sabay-sabay yung mga ibang drugs na bibigay sa kanya? Right? So, madaling gawing conclusion because it's popular, because people are desperate. Yeah. And get the shot. No more delay. I think everybody knows that. I mean, right? We don't even know which brand. It's not about brand. Every vaccine that's approved by WHO works. No excuse. No excuse. Finally, I reached my home. And that's just the beginning of my other half of the day. The frontliner has to read. The frontliner has to look up what's new. Not from the news, from the journals. That means we start looking at virtual libraries, thousands of journals with just one word. Another word, 30,000 journals. We picked what we want, like this one. Does COVID-19 pneumonia significantly cause scarring of the lung? Patients will ask, Doc, why did it happen? I said, I don't know. Give me time to read about this. Right? What is the incidence nakakaroon ng tubig sa baga ng COVID when we know it is very rare? Oops, there's now a state of the art about that. Wow. Hindi pa nila alam. I'm going to be the first to know. Yun. Then I start putting them into a file. Hanggang hindi pa ako inaantok, I will keep a file. Anytime I can go back. When I get an invitation to talk, I got the file. Every night, I have to be prepared. And then I get the call, Doc, this weekend, a young doc frontliner said, I have to make a presentation. Can you help me on that? Okay, let me look it up. So I start looking up and send them my work to help them read, to help them prepare. That's it. And then now I realize it's already midnight. Maybe time I have to go to sleep. Till then. After all, when it's midnight, my day is about to begin. So, good night, ladies and gentlemen. Thank you for your attention. This is one day in the life of the frontliner among many other real frontliners. So I'd like to say thank you to Sam, to the Alumni Association, to my wife Lori who answers my call, and to be so kind, minsan kung di ko naririnig ang call, she will throw something at me. Most of the time, it's the pillow to wake me up. Yes. And I would like to say thank you to John and Lori because she helped me took some pictures for this presentation. So, it's good to be alive, but you won't want to go through this experience. It's too painful. The worst thing that can happen to a frontliner is kung magiging manhit siya with all the fear, the anxiety, the pain and sufferings around us. Then that will be the day we must stop our practice. Because one day we will be answerable to our Maker. People are watching. You have to do your responsibility as citizen of community. Get the shot. Encouraging them to get the shots. The earlier, the better. Give it for free if you can afford to help them. For those who cannot afford it. Thank you, everyone, for your time. I've spent more than an hour now. Thank you. Bye.
Thank you very much, Dr. Daniel Tan, for a very different insight, to a lot of these webinars that we have been through. This is one of those that gives you a different outlook and different view, and we can now understand more on the on the things that a doctor has to go through to give us a good advice, and we thank you for that. I have received a couple of questions. I think we have some time that we can answer some Q&A. The first question is, what if the patient wants the doctor to be truthful about his or her chances so he or she can prepare? Would you tell him or her?
So let me elaborate now. Let me elaborate about truthfulness in critical illness. Meron kaming sixth sense, or you want to call it high level of EQ. When we talk to the patient, we have an idea yung psyche niya, whether he or she is willing to know the truth. But yung sabi mo, Sam, gusto na nilang malaman yung truth eh. When they want to know the truth, we share with them the truth. In fact, every patient should know the conditions they are in. Very often, it's the family who will tell us not to be too truthful because they know the patient better, right? But when we do share with them, there are doctors with the skill of making difficult subjects easy to understand. But there are also doctors who are very good in explaining to the patient and family. At the end of the session, when you ask the family, do you understand? Everyone will say, we don't know what the doctor is talking about. But when I'm there with them, I understand what the doctor was saying. It turned out the terms and used by the doctor was too difficult to understand. So that requires a skill. Some doctors will know how to do it, how to make it understandable. Some will be so good, but totally unaware that the patient doesn't understand anything he or she is saying. So, kanya-kanyang scenario in that case, different case. So, do we tell them the truth? It should be. But remember, this is family, right? Hindi lang pasyente. There are patients who want to know the truth despite the ayaw ng pamilya. There are patients who don't want the truth, and the family wants us to tell the patient the truth. So different story, different background, different scenario.
Thank you. Maybe as a follow-up to this, I noticed that in most cases when you talk to your patient, you always bring God into that discussion. And in this case, how would you present it in a way, telling them the truth?
We have to be very selective. There was formerly a priest who I tried to share also. Pare na yon. And after several visits and discussions, sabi niya, Doc, I really appreciate you coming me, visiting me, talking to me, but you never talk about Mary. Halatang halata, Doc. yung mga ganyan ba? So you kinda... But most of the time when you're facing death and suffering, the receptiveness is there, diba? So we are sensitive to their requests. We also offer them. When there will be special procedure, we also talk to them, whether they would like us to pray with them. So it has to get into the habit as part and nature of our profession. Of course, there are very few doctors who do that, diba? Kasi nahihiya sila eh. Doctors don't want to share the human aspects of their lives, diba? Because we're used to making orders, giving instructions. Patients should follow. We call that the paternalistic approach to patient care. And that paternalistic means ako ang tatay, akong boss, you just listen, you just follow. Pero there are patients who say, Doc, you know why we appreciate you? Because you make us understand. You make us understand that you feel what we're feeling. You feel our pain. And all this is from the way we talk, the tone of our voice, our approach on the first second when we enter the door, and how we leave the room after our visit. Patients are wise now. Alam nila eh. We cannot take them for granted.
Thank you. I have another question here. And the question goes like this. Can a medical frontliner with mental health problems perform his or her duties as expected?
Mental problem.
I don't know the extent because in terms of the question, I don't know.
Anong problem ng mental patient?
No, this was just a question asked, so I don't know what extent. Maybe you can just narrow it down to us.
In other words, how do we treat the patients with mental illness, right? Yun ba yun?
It's medical frontliner with mental illness.
Yeah.
With mental problems, maybe not illness.
Meron. Under stress, marami. It's hidden, frontliner. But usually during the surge. And a frontliner a frontliner can burn up under severe stress. They can go into depression. We have a number of sessions na involve ako sa presentation of how to spot, how to deal with frontliner under severe stress and depression. Because even the person may not, the frontliner may not realize it. And the session was about self-realization, what are the steps toward resiliency, how to overcome this difficulty during this very stressful time. Because some of the signs can be seen, hindi makakatulog, lang ugali nila sa pasyente naging very negative. They can still apparently make decisions, but it's compromising decisions already. So there are signs that can be spotted. These are warnings that have been discussed among management group ng hospitals, how to spot some of the frontliner in the medical team that should be searched for and offer help to them. Meron talaga. And they need psychiatric help.
Okay. Can you share with us a little bit of your personal experience when you went through the COVID yourself and how you overcome it?
I didn't overcome it. It was the timely admission, confinement. Remember yung sinasabi kong timely? Kasi yung antiviral, originally, yung remdesivir is given for Ebola virus. What they were able to notice is it's able to prevent the viral replication. See, remember the curve? I showed you the curve, right? When the viral load is so high, that means nagre-replicate. And if you can give it early enough, before more viruses are multiplied, you're also decreasing the degree of inflammation. Number two is, of course, ang advantage ko, wala akong risk factors. Remember the risk factors? What are these? Obesity, diabetes, cancer, heart disease, kidney disease, yung all of that. Wala ko eh. Control ng blood pressure ko eh. Kasi hypertension is also a risk factor. So when you don't have this, na-expose ka, and then your oxygen begins to drop, and you're at the right time for treatment, higher chance of recovery. So because of my own awareness of the timing, and I felt the improvement already on the second day, alam ko na, hindi pa tapos ang mission ko, as they call it. I'm gonna survive this. But during the time I was confined, I was still managing my patient on the other ward, yung sa COVID ward, the critical care. And during that same week, 3 of my patients died. But I didn't tell them I'm on the other wing. I was on the other wing, yeah. But 3 patients died, my patients, of respiratory failure. That means naka-ventilator na, yung nakita mo yung eksena, naka-ventilator and all that. But the oxygen didn't want to go up. So they died gasping for breath. That just couldn't save them. And death to me is, again, a deliverance from suffering. That's it. And if, again, you say, if the family understand it was beyond help, it was better not to even resuscitate. There's no point.
Okay, I think we may still have about 10 minutes. If there are any more questions, please indicate yourself. Let us know, and you can just say your question out. Any questions? There's one. How do we know if we're not being paranoid as soon as we get a high fever?
It's better to be paranoid. It's better to be paranoid and prove it is not COVID. Right? I think you understand that. Because a delay in confirming, and then magka-catch up tayo, it's too painful to regret later. But remember, no? It is the understanding of the timing of the virus going up, the timing of the test, to say that it is a true positive, we call that. If you do the test too early or routinely, it can be negative kasi wala. But maybe just after that, after the incubation period, yung nakatanim na sa baga mo, tsaka lalabas ang symptom, you will say a few days ago it was negative. Eventually, if you repeat the test, it can be positive. Or doing the test too late, it can give you a false sense na negative when in fact you came from positive. So we put a lot of emphasis sa detailed history taking. Remember that day one is the most important information in the journey of the COVID illness, day one. Because we can do the days, the counting of the days, and anticipate kailan lalala, kailan dapat mag-improve. But many patients go outside the box. The recovery was not, some of these patients, their recovery were not as expected, not drug on too long, simply because of the factor ng comorbid conditions. Dahil sa iba't ibang sakit.
Okay, I have a few questions here. One is, do we really have to be vaccinated?
Of course, I said that already.
Here's a follow-up to the question earlier, which is, do we wait for high fever or just constant coughing will do?
You can have fever, you can have cough. Basta hindi mababang oxygen, hindi mabilis ang breathing, stay home. The only people we need to confine are the people who are short of breath. Or because of this illness, nakabulbuhol na yung sugar control, blood pressure is too high. You know what I'm saying? Yung dahil may comorbid conditions na, dahil sa COVID, lumala yung ibang mga original problem mo. Then you are going to be confined not just for the COVID, because of the coexisting illnesses ng katawan that needs to given attention because of the worsening from the effect of COVID.
Do you recommend buying an oxygen concentrator, or they call HFNC?
Only if you buy it from me. No, I'm just no, there's no need eh. Kasi after that, what you use with it? Ano man, there's no point. There was a time during the surge, all the supply ran out of it. There's no point. Because by the time you need oxygen, you're supposed to be in the hospital, di ba? What will oxygen do?
Okay, next question is, will a COVID survival still infect others?
No. If you have a lot of coexisting illnesses, you're very old, the elimination of virus will be delayed. But eventually, mawawala rin sa katawan. So usually by the time, remember always the day one? Usually by day 21, it should not be in the body anymore. Kaya remember some of this quarantine period, hindi lang 14 days, ina-extend pa nila ng additional 7 days. That would be personalized advice on the basis na we probably will suspect, because of your condition, your ability to eliminate the virus from your body will be slower. Please isolate 1 week longer.
Why is it that some COVID survivors still contract COVID?
It's very rare because the immunity prevents it from happening. But it has been shown, the earliest case Hong Kong, proven yun. And then there's another one that was in the literature journal in US, Udin lang. It can happen, but it's very, very unusual.
Here's a question. Let me try to analyze this. Is day one the onset of symptoms?
The first
or
symptom.
day one of exposure?
No, the first day of the symptom, not the day of exposure. Many patients don't know when the exposure began. It's the day one of the symptom. But you can count on it. Yung day one mo is not the beginning of contagiousness. It would have been a 5 days plus minus before the day one, you were already contagious. Kumakapit sila sa lining ng ilong at sa airway. And many of these patients with sore throat and dry cough, nakakalat na yung virus eh. Kaya mahalaga yung mask simply because it's not just to prevent you from getting it, it's preventing you from spreading it. Ang problem is, the more I read, I realize, baka siguro nahawa rin ako. When you put on the mask, never touch the front. Kasi yun ang nandun ng virus eh, di ba? So when you touch the front in the removal, and then you touch your eyes or your nose, that's where you spread it to yourself.
I see. There's one time, I think we also ran out of the oximeter. Is it necessary to have one at home?
Since shock la, if that's the only reason, bukan ng pa ko, sige lang. But then what do you need it for after your COVID? But you may need it as a criteria, as a condition that you need to go to the emergency room. Because it's black and white. Below 94, you're short of breath, go to the ER, be ready for confinement.
Okay, thank you very much, Dr. Tan. I think we have heard a lot of very interesting insight tonight, and I think we know a bit more now on what needs to be done, particularly your recommendation that we all get vaccinated.
You mean there are still reluctant alumni to get vaccinated?
I hope not, but there are still some that I've heard.
Yeah, I have a personal view about that. It's a toss-up between personal right to decide not to versus becoming asymptomatic COVID and you ended up spreading it all over the place. It is also a moral responsibility to get vaccinated. So we will not harm the people that we care and love around us.
That's a good closing statement from you, Doctor. I think it's our responsibility to care for the others by not spreading it. If we can have ourselves vaccinated and have prevention ourselves. So thank you once again on behalf of Silverians and the Alumni Association of Hope Christian High School that you have shared with us tonight. We thank you very much, and may God continue to bless your ministry and your profession in the health industry. Thank you very much. So before we close, we have a closing remarks from our very own Silverian advisor, Brother Alejandro Co.
Distinguished resource speaker, Dr. Daniel Tan, along with our moderator for this webinar, friends and fellow Hope Christian High School alumni, I would like to extend my profound gratitude to each and everyone that makes today's webinar possible. Thank you for sharing your time, your thought, and compassion to all the sacrifice, as well as heroic deeds of all our frontliners. It is heartening to note that Dr. Daniel, apart from being internal medicine pulmonologist at UERM Memorial Hospital, Dr. Tan is also a COVID survivor himself. We are all very lucky and thankful for having all beneficiary first-hand information and know-how about COVID-19, as well as our frontliners struggle. On a personal standpoint, we all had a realization amidst this heartbreaking pandemic. More than our business, wealth, status, society, family, and life, is the utmost important, let us salute to all our medical frontliners who carry out most of the burden in combating this pandemic. They are the ones who make supreme sacrifice. Our duty now is to protect ourselves by getting vaccinated so we can protect our family, friends, and loved ones. As we conclude, let us be reminded that it is our moral obligation to adapt to a new normal and to submit ourselves by following health protocols. We still have a very long way before reaching herd immunity and get our life back to normal. But with cooperation, we can ease the burden of our frontliners. Losing hope, not an option, but standing as one united Christian high school community will make a difference. Thank you, and may God bless all with a good health.
Thank you very much, Alejandro. To close us with a closing prayer, may we have Silverian's Julie Ngo.
Let us come before our risen Lord in prayer. Our loving, ever faithful Father in heaven, before we close this meeting tonight, we want to lift up our hearts with thanksgiving, for it is all your plan that we are able to gather together in this virtual meet, that it is you who provide us with the blessing of having a God-loving servant, Dr. Daniel Tan, to share his knowledge, his expertise, experiences in handling the present health problems. We thank you for the life of Dr. Daniel Tan, our Lord, and we pray that you will always bless his work as he continues to share his experiences to enlighten others. At the same time, we pray for the listeners that we can have the courage to share what we have learned tonight. May you bless each person who took time to gather here with us tonight. Let your hand of mercy and protection be upon each one as we continue to journey the days ahead, knowing your grace is sufficient for us. Thank you, Father God, for a fruitful evening with your presence. With highest glory and praises, we lifted up everything in the name of your most precious Son, Jesus Christ. Amen.
Thank you very much. And this concludes our program for tonight. We hope that everybody can be part of our alumni association, wherever, whichever batch you belong to. And for Silverians, our monthly meeting so that we can stay connected. Thank you very much, and good night.
Good night. Thank you.
Thank you. Thank you.
Thank you. Thank you. Bye.
Thank you.
Thank you.
Bye-bye. Bye-bye.
Take care. Happy
Bye-bye.
weekend.
Thank you. Happy week. Thank you.
Thank you, everyone. Alejandro, Tosha.
Good night, everyone.
Good night. Good night. Thank you.
Thank you.
Congrats, Sammy.
Thank you, Doctor.
Ma'am Satu.
Dani,
Tahang Sundi.
Tosya, Dani, Tosya.
Hi, Mari.
Bye. Bye. Thank
Hi,
you.
Susan.
Thank you. Thank you.
Alejandro, ulang le request for 这个 recording 的，咱这结婚哦 alumni association 的啦。
Ito hindi ko na kay Yok Pilay. US ko ay chong si USB na lang at kaki.
nanda 结婚咱老咧